Hey guys, my name is Giulia. I'm a strength and conditioning coach and a certified pre and postnatal fitness trainer. Just to give you a little bit of an idea of what I do, I work with women during their pregnancy and postpartum and help them find the right exercise routine for them and also help them get back into shape after giving birth. In this video, I want to answer a very common question: is exercising during pregnancy safe? If you've been researching this topic and finding confusing information, that makes total sense. Because as is with many topics today, there are so many contradicting things out there, and it's sometimes hard to know what is true and what isn't. So I'm making this video to help you make sense of some of the information you may have come across. But before we get into it, here's a short disclaimer. I am not a doctor, I am a fitness trainer. And when it comes to fitness in general, but especially exercising during pregnancy and postpartum, there is extra caution to be taken. So please consult with a healthcare provider and make sure you are cleared to do physical activity and find out, based on your condition and your development, if there are any limitations you should apply to your training regime. So always check in with your medical provider and do so regularly throughout your pregnancy. This is super important as the months go on and also following delivery. The goal of this video is to give you evidence-based and up-to-date information regarding pregnancy exercise so that you can feel reassured about what you can and cannot do. Okay, so that being said, let's get to today's topic. Exercise during pregnancy, is it safe? Number one, is exercising during pregnancy safe? It is absolutely safe, and more than that, it's the best thing you can do to reduce the risk of in-pregnancy complications and improve maternal physical and mental health. I'm not only saying that it's a nice thing to do, but rather that it is a must. Number two, what are the benefits of exercising during pregnancy for the mother? Scientific evidence has shown that exercising during pregnancy is associated with decreased risks of needing a C-section, of urinary incontinence, of preeclampsia, or gestational diabetes, and excessive weight gain during pregnancy. And that's not even discussing the psychological health benefits of exercising. And these are not any different than those that you would see for someone who is exercising in a non-pregnant state. Some of these are improved mood, improved body image, increased feelings of energy, and reduced feelings of anxiety or depression. So basically, if you don't have any contraindications, go for it. Of course, as for someone who isn't pregnant, you can't just show up the first day at the gym and go all out and do things that your body isn't primed for. There's always a safe and effective process to follow, and to add to this, I'll discuss exercise type, exercise duration, and intensity shortly. On the other hand, if you have been diagnosed or are experiencing some medical conditions and contraindications, such as persistent vaginal bleeding, incompetent cervix, or recurring pregnancy loss, you should not perform vigorous activities. If you want more information on what these contraindications are, please check the link in the description, and as always, discuss what your options are with your medical practitioners before you do any type of exercise. And for number three, let's now discuss some important parameters of training that you should take into consideration regarding exercising during pregnancy, starting with duration. The general guideline is that a pregnant woman should get at least 150 minutes of moderate intensity exercise each week, and that this should be spread over a minimum of 3 days a week. If you feel like doing more, great. Remember that this is a minimum recommendation. I also recommend that you walk every day and try to hit that 8 to 10K steps, regardless of whether you have done a workout on that same day. Let's move on to intensity. You do want to stay clear of those so-called high-impact activities and activities where the risk of falling might be higher. It's okay during the earlier stages of pregnancy. There are many women who still play high-impact sports during the first trimester, and some even longer. But generally speaking, it is better to stay on the safe side. Now, many of you will wonder, how do I know what intensity I'm at, and how do I quantify that when I'm exercising? Heart rate is still one of the most accurate ways to monitor exercise intensity. And here's a little table that shows you the heart rate range per intensity of exercise. And ideally, you want to stay in that moderate intensity zone. If you have a fit watch that shows you your heart rate, it is a good idea to use that. But if you don't have a watch that shows you your heart rate, or maybe you just don't want to keep checking your heart rate, in that case, an easy way to do this is the talk test. And that simply means that if you are not able to carry a conversation during that activity, you should reduce the intensity a little bit. Now, I do have mixed feelings about this. Keeping your activity within the moderate range is the easiest and safest way to make sure you're not overdoing it, which is great, but I also don't want you to think that you absolutely cannot reach higher intensities. You can, as long as you do it in intervals of 20 to 30 seconds and then come back to a moderate or low intensity. And finally, let's talk about the type of activities you can do during pregnancy. This really isn't any different than what I would recommend to someone who isn't pregnant. The best is to combine strength training and cardiovascular training. But what I think is even more important is to do something that you enjoy. This will help you be consistent, and consistency is really what will ensure that you see positive results in the long run. However, pregnancy is not the time to beat all your records. There's no reason you shouldn't be able to maintain your current fitness levels and even improve on some of the fronts without stressing your body too much. Adding yoga or Pilates and some mobility training is something that I highly recommend. It will help you train those core muscles that you will need during delivery, and it has also shown to be very effective in alleviating lower back pain and pelvic discomforts, which are so common during pregnancy. As I mentioned before, there are a few activities that you should avoid. Those include activities with higher risk of impact with your belly, such as, say, football, basketball, or boxing, anything where there might be jumping or hitting. Also be mindful of the risks of falling. That's also riding a bike, for example. The stationary bike at the gym is fine, but also activities like skiing or surfing are not recommended. And I would also avoid exercising in high temperatures to stay clear of overheating and dehydration. So to give you a little summary of everything I've just said about exercising during pregnancy, intensity and type and duration, during pregnancy it is recommended that you get a minimum of 150 minutes of exercise per week spread over a minimum of 3 days. Avoid high impact activities with high risk of falling, especially from the second trimester on, and keep the intensity moderate. That can be measured via heart rate or the talk test, or keep vigorous intensity under intervals of 20 to 30 seconds. And lastly, I do want to talk about pelvic floor training because I find it so important. The best advice I can give you is to not wait until after you've had your baby to start training your pelvic floor. It's best to start during, or even better, before your first pregnancy. This will help you decrease chances of urinary incontinence and pelvic organ prolapse, and will also help you with the recovery of your pelvic floor after delivery. There are so many videos on YouTube that show you how to perform pelvic floor exercises, which is great, but I do recommend seeing a pelvic floor therapist for 2 reasons. Number one is that it's pretty difficult to know if you are actually activating the right muscles when you do these exercises. And number 2, a pelvic floor therapist will be able to identify weaknesses or other issues that you might have before they become a bigger problem during or after your pregnancy. So to answer the main question of this video, is exercising during pregnancy safe? The answer is yes, absolutely. I hope I've given you a good insight in what types of exercises you can do or the ones that you cannot do and under which conditions. Remember that every pregnancy is different, and you might have days or weeks where you just don't feel up for training, and that's okay and completely normal. Do the best you can while trying to reach those exercise recommendations. And most importantly, do so by doing activities that you enjoy. And that's it. If you want more information, or if you like me to make another video like this, leave me a message in the comments below, or message me on Instagram at mummy.fitness.gram or on my website mummy.fitness. Don't forget to hit the subscribe button to see my next videos, and thank you for watching.